So I'm going to give you a little bit of an example of some of the patients I've treated in the past. Now this is a person with chronic headaches, neck pain, arm pain, and back pain. Blue line is normal, which is this curve. The yellow is them. As you can see, this is a severe misalignment. This person had horrendous pain. Guess what? MRI was negative. So the spine is far from normal. That's a huge kyphosis. Remember this number, 29. Now I'm going to let you zoom in a little bit so you can see it. So what did we do to fix this? Okay, now this type of problem could take several months to fix. I only had, I believe, 2 months or 3 months with this patient, and then they had to leave the country. But we did a tremendous correction. So one of the things we do is we do exercise. So we're going to put the neck exerciser right here, okay? So this is called the neck exerciser, and we put this right here, and we put arms going up, okay? And this is an exercise that we do, and we would focus it right at the apex. Now, we also would use an instrument, and very simple. Some people like a manual adjustment where I use my fingertips to move the bone. Some people we use an instrument that they don't like the cracking sound. They don't like the manual or the fast adjustment. So we can use an instrument, and we would put that right here. Then we also would do home traction. Home traction, we use something called a dinero roll. And we'll talk more in detail in the next video about it, but this is what it would look like. The person would lie on their back, and they would reshape their neck. They would do this 7 days a week, 20 minutes. Now, we start out at 1 minute, and everything we do should be pain-free. Nothing should hurt, no blurry vision, no dizzy, no nauseous. But that's how we would correct the spine. Adjustments, exercise, and traction. Very simple. Now let's look at the post. Okay, go ahead and slide down, and let's see. Well, won't stop right there. Now this is the flexion. Now the red arrow indicates that the skull and the first vertebrae are locked. When you bend your head forward, those vertebrae should separate. And I'll show in a minute what that should look like. Now, right here, this is another locked vertebrae. So we target the adjustment, we target exercise, we target the dinero roll on the locked vertebrae. Excessive motion occurs above that. Slide up just a little bit. Yep. Keep going. Right here. Now this is the post. If you notice, the yellow line is much closer to the blue. In fact, I think we went from 29 to about 17. Now, again, this takes time, and I believe we only worked with this patient either 2 or 3 months, but within 2 or 3 months, the spine is getting close to normal. This would be considered a very severe or very large displacement. And the person was asymptomatic, headaches are gone, numbness gone, neck pain better, back pain better, because we changed alignment. And we got that information from the X-rays, both flexion X-rays to test for excessive motion, and then also the static X-rays. This is another patient with a flexion X-ray where their head is bending forward. In fact, this is the skull. And if you notice, this is the skull right here. This is the first vertebrae or the atlas. Notice how there's space. And the previous X-ray, there was no space. That was locked. Now, this right here is excessive motion, right here. There's ligament damage. So when one area of the spine becomes locked, usually something above or below moves too much, and that's not good. So that's why the difference between general manipulation, sometimes you see that on the internet, versus targeted, very specific adjustments, very specific exercise, very specific traction, that makes the difference in results for long-term pain relief. This is an example of another misaligned. The blue line is normal, yellow is the individual patient. Look at this, the amount of distance between the yellow line and the blue. That's the pre, this is the post. Patients lined up perfectly, still not perfect, but much better. Again, adjustments, exercise, traction. The key is specific diagnosis. That means treat each person with an individual, get targeted exercises, not general. Get targeted adjustments, not general manipulation. Traction is always a very unique thing for the patient. You cannot do this at home without a doctor's supervision. Not everybody has the same treatment, so you need to get a motion x-ray, find out where the instability is, find out the degree of instability, and then you personalize treatment plan for the best results. This is another example of a kyphotic neck, and that is indicative of ligament injury. So again, the ligament injury can be from one trauma like a car crash, or what if you worked 20 years with your head bent over in a shoe factory? I've had patients do that. So look at the difference. Look at this number, 17.68. Blue is normal, yellow is the individual patient, and after adjustments, exercise, and traction, this is the post x-ray. As you can see, the blue and yellow are closer. This is a structural change, and guess what? When you are aligned, you function better. That means elimination of headaches, neck pain, arm numbness, arm weakness. The body functions better when it's aligned. Your car functions better when it's aligned. The plane that you're going to fly in on your next family vacation functions better when you're aligned. Get a motion x-ray to determine your alignment when you're static or neutral or standing still, but also you want to know at which vertebrae are stuck, which have excessive motion or spinal instability.